Does it feel as though managing your facility's balance sheet has become increasingly difficult? Today's landscape has changed, and while reimbursement continues to tighten, pricing has to be made available to the public. So it's imperative that your charges are simplistic and clear for consumers to understand. And we've all heard stories in the news about patients receiving these astronomical bills for services rendered, and it causes an uproar that it might not even be the actual amount due. So it causes a lot of bad press and negative views towards the way that healthcare charges are carried out. Each and every hospital and health system out there, they're trying to strike this balance between setting up charges that are consumer and market friendly, and then also making sure that prices are in sync with their payer contracts so that they're not leaving any money on the table. In this post or during COVID world, however you want to look at it, we have a lot of new considerations that we need to deal with. Costs for labor have increased significantly, and at the same time, volume and staffing have decreased. You at the hospitals literally need to do more with less today. So now with the increase to patient pay responsibilities, the need for price transparency and upfront discussions regarding the cost of service, that's a real, albeit a daunting task. The truth is, with all of these other factors changing, there is one thing that's remained the same. Your commercial contracts are going to produce an annual increase somewhere between 0, maybe up to 5%, and 5% on the high end. Chances are that's not cutting it. So what could we possibly do about this? Well, what we're finding is by working with our clients to gather real and timely data, we use publicly available price transparency data, we use real 835 payment transaction data, and we build this playbook. We create a framework to discuss with your payers your specific pain points. And then we propose fair and actionable items and solutions that will ease some administrative burdens and offset the increase to your rising costs. It's vital that payers are brought into the conversation about the struggles that the hospitals are facing, and negotiations need to include sound data that illustrates just that. If you'd like to have a conversation about some of these issues, contact us today.